So I'm here with Crystal Evuleocha, the CEO and co-founder of Kliit Health, and also member of Launchline Accelerator. Can you tell me a little bit more about your company and why you started it?
Hi, so thank you for this interview, of course. My name is Crystal Evuleocha. I'm CEO and co-founder of Kliit Health. We're a digital health platform that connects young people to trusted experts. So OBGYNs, nurse practitioners, midwives, sex therapists, and a few other women's health clinicians to answer their intimate sexual and reproductive health questions so they no longer have to rely on Dr. Google. So I started this company in December of 2018. So we've been running for about a year and a half now. I just for context and background, so I'm an immigrant. So I moved to the U.S. in 2010 for college, and I essentially, I come from a very conservative background. Never really discussed anything about sexual reproductive health, and was navigating this new world, so to speak, being in a different country, being in college for the first time, being recently sexually active, and every other thing that could possibly happen to a young person. Like I said, navigating that, I had a very, I would say life-changing experience happen in that time. So I was, of course, young, relying on Dr. Google for answers to everything. And one particular time, I, had unusual pain in my stomach during my period. So I went to Dr. Google and I found lots of different resources that were very similar to the pain I was experiencing. So I started self-medicating for period cramps of all things. And fast forward to a few days after my self-medication in silence, I, felt extreme pain. I passed out. I was rushed to the hospital for emergency surgery on a very different condition from everything I found on the internet. And of course, this was a really, like I said, traumatic and life-changing experience. You can just imagine like someone who's in college, international student, trying to figure out like school and everything else, and also having to deal with something like this with family in a different country. So, post this experience, I started becoming more of, I would say, so to speak, like a advocate for women's health. So telling all my friends, hey, let's go to the clinic, let's go to the women's health center, let's get this, let's get HPV vaccines, like anything that was available to us on campus, I was like the poster child for getting it. So, so post that, in my background, I studied econ and business in college. So I, started my first company called Benola Cristal, making men's accessories. So it was an e-commerce company making men's ties, bow ties, and things of that nature. And then, I still really wanted to do something, that had a very huge social impact, that was very close to home. Of course, like I'm an entrepreneur by heart, like I've always been. I used to do hair and nails and everything in college and made a lot of money doing those things. But then, post running a first company and generating revenue there, I started this company, Kliit Health. And like I said, we launched in December 2018, and we've been that, I would say, platform that just connects women to experts. So, yeah.
So crazy story. I'm not going to tell the whole thing because it's way too personal. But after having it, my mom is Greek Orthodox, and
Okay.
I like she's a lot more. My parents are very liberal, but my mom's a lot more conservative than my dad is, and I was kind of in
Okay.
a similar situation. I was actually given the wrong advice as I transitioned from my youth into adulthood.
Mm-hmm.
With my I guess my primary doctor, there comes a
Mm-hmm.
point, I can't remember when kids switch over from pediatrics, but it's actually way older than what people would think. People go to a
Yeah.
pediatric doctor for a long
Like
time.
20,
So when I
20
was
something.
20 something, yeah, I
Yeah.
remember because I went to my pediatrician when I was a teenager and I just came out. And
Mm-hmm.
so when I told her that I wasn't being sexually active with guys, her advice to me was that I didn't need to go to a gynecologist. So
Interesting.
exactly. It was interesting is like one word for it. It's kind of
Yeah.
crazy
Like,
to like, I know it's
yes.
mind blowing. But I guess like there's, even when you go to a doctor like in person, sometimes you could get worse information than you get from Dr. Google. And so like for a long time I had leaned into Dr. Google, and when I went to college I learned a lot of things on my own. And I've been with the same person for about over 10 years and recently became single, and dating and not knowing a lot of these things. I didn't realize how much I didn't know until I had to Google some stuff. And it's crazy because I did a lot of volunteer work with Planned Parenthood back in my
Mhm.
hometown when I was in high school. And so I knew a lot of things, but most of the stuff that I knew about was about just like heterosexual relationships and
Right,
sex.
right,
And
right.
I didn't necessarily know about my own body, even for me.
Mhm,
So when I
mhm.
started to go out dating and things, I started to worry about things that I never had to think about in a long-term relationship, like STDs. And I was just like, well, like, how, like, what is it like to get tested? What, like, what is it like, like, what's normal, what's not? And I also have had really just like the worst periods in the past, and I have plenty of friends that have gone to, and everybody goes to Google. So I think in many ways I have a deep appreciation for what Clit Health represents, and what it's all about. Just coming from the origination story, even, I mean, it's very relatable for a lot of women, to not
Mhm.
have anywhere to get these answers and have really serious things going on with their bodies, but get really janky info just from Google. So
Right, for
thank you
sure.
for that.
No, no, for sure. And even, yeah, like even you spot on, like even as far as like, and this is something we discuss all the time. There's people who go to see a doctor in person, and the doctor is one thing, not culturally competent, not aware of what's going on, assuming a lot of things, like assuming you're in a heterosexual relationship, or assuming that, your body is the same as every other woman, which is a lot of times not the case. Different folks that come from different religious backgrounds, sexual orientations, race, and things like that, having to deal with things very differently. And that's the whole purpose. So, our whole thing is around cultural competency and inclusiveness, as far as making sure everyone in that conversation feels like they're talking to someone who truly understands what's going on. Because Dr. Google is not going to know who you are, or what your sexuality is, or anything like that. It's going to give you the majority of information, right? And the majority might not be what is for you because you're a minority, right? So just thinking about that in that respect is the reason why we created a platform like this. Even outside of Dr. Google is, of course, empowering in the hands of people, because you want to be able to go and type in stuff and figure out what could be the case. However, it is very dangerous in the hands of non-experts like myself and you, and just every person who searches these things, because you would find everything under the sun. So yeah, so that just goes to say, like, yeah, that's our whole purpose and point of doing this. So thank you for sharing.
Yeah, yeah. On a side note, I'll tell you, in a one-on-one at the end of this, without putting it onto this recording, I'll tell you the very serious
Absolutely.
situation that happened to me, and the information that I was able to get when I stopped Googling and went to see an actual
Absolutely.
professional.
Awesome.
But so I totally get it, and I think it's wonderful, and I love the name
Absolutely.
because, like, how, I guess, you know what? How did you come up with the name? What made you want to lean into that as a name?
So, I mean, leaning into that was, it came from a place of, okay, there is a huge need. There is a conversation that is not being had. Our whole point is destigmatizing conversations around these things just in general. Because when you think about young people, or just people, and like, whenever I say young people, like, I really am referring to like young adults, because at the end of the day, like, even folks who are like in their 30s, 40s, you would be surprised the number of them that don't know anything about their body, don't know what the different parts are called, think that, vagina and a vulva are the same thing, or just don't know they have different holes in their bodies. Like, like our chief medical officer, Dr. Candace Fraser, she says she talks to a lot of 30, 40-year-olds who have had children before who don't know they have different holes in their vagina. Like, there's, so there's not that conversation being had, and the types of conversations that are being had are around, yeah, it is mind
That's
blowing. The conversations
mind
are around,
blowing.
like, abstinence, or just no sex until you're pregnant. And it's like, how do you get pregnant? Like, how do you get through that process? Like, we're not just created to be pregnant. We're not just created to be like moms. Not everyone wants to be a mom. Not everyone is designed, to be, no, everyone even has the intention of it. And for the ones who do, making sure they're prepared. So when they do want to go through that process of conceiving, of pregnancy, and then when they go through postpartum, they're actually equipped with the help they need, right? So the whole stigma being one thing, like even like coming out, like a young person being able to say, this is me, this is who I am, this is who I love, this is, how I am built and designed, it's not, it might not be what the doctor thinks, but it is my reality. And I want you to be able to understand this and treat me accordingly, right? But in order to even have that conversation, you have to be comfortable talking, period. And, what's the point hiding behind down there, or like your hoo-ha, whatever you want to call it, when you could just call it a vagina? So that is the whole purpose around it. I mean, we have, our entire company is built around that. And that's something that we've done actively, being able to educate young people, talk to them with language that is not, hush hush, just being like, this is what you need to do, this is who you need to talk to, and these are the parts of your body that you need to know to be able to have those informed conversations. So
That's great. I think that's wonderful, especially as someone who who was super sheltered and in many ways is
right.
still learning new things every day. I have a really great
Mm-hmm.
appreciation for that because it really is important, and maybe what my mom has comfort talking about, like her comfort level might not match mine. So it's nice
Mm-hmm.
to know that you have a safe space where you can go and get that information. And to dive a little bit into your experience of Launch Lane, when you first applied for the accelerator, what were you hoping to get out of it?
So what was I hoping to get? So I was actually, when I applied, the thing that drew me to Launch Lane was actually the process of the application. One thing, and of course, like the relationships with the universities, being that, we have a product that we're launching that is specifically for university and college students, right? So when we thought about, when I read everything about Launch Lane, we saw, you had to be a company that's trying to create jobs, and a company that's doing, innovative ideas for university populations and things like that. It just made 1000% sense, because at the end of the day, we're building an ecosystem of clinicians who we're giving jobs, and those clinicians can be in any state. We would have thousands of clinicians in Philly. We will have thousands of clinicians in New York. So it just made sense for us, for myself as a founder, just going in and saying, okay, like I want to join this program, number one, because I want to learn how this ecosystem works, and I want to, build something that does create jobs and build something that does work for students. So that's why I applied. Just in a nutshell, it all full circle made absolute sense for me to participate in this.
Yeah, no, I mean accelerators are great for that, and I think that I think that more people should consider them, just because you get a lot more out of accelerators than just what people put onto the website.
Right.
At least it's that way
Mhm.
for us with LaunchLane. We really try to meet the companies with where they're at, and with what you need
Right.
in that time, and
Right.
work out, even going outside of yourself and trying to find the right people to connect the companies with, not
Mhm.
just looking inside of our own expertise. That's one thing I really
Of course.
appreciate about the Launch Lane team personally. And
Mhm.
going through this shift with the pandemic, um, happening to us all,
Yeah.
how, if at all, have your priorities shifted now that we're in the pandemic?
Yeah, this pandemic has been challenging for everyone. I even know, like within the accelerator, like we had to move to virtual, and trying to navigate still building a level of community, without seeing each other has been challenging, and that has affected every single sector. Like we're in healthcare, right? And there has been a huge move towards the idea of telemedicine and virtual care for folks who cannot go in for typical visits. There's a lot of moms. Like I have friends who are either just had a baby a few weeks ago or are currently pregnant or ready to give birth, and their partners couldn't come in with them. Like it is such a challenging time. And then more than ever, folks are leaning to the internet for information, or virtual health, because you can't just walk in and do like a pap smear right now. You can't do a lot of things that people are being encouraged to do to benefit their health, is even getting less and less, pushed down like to the back burner because of the state of the world right now. What has been good is, telemedicine regulations and rules have been relaxed a little bit more, to accommodate the current state of the pandemic. And, a lot of restrictions have been in telemedicine and the business of healthcare. So I think what's been great and what is really good right now is, adopting and, quickly to life as it is, right? And also meeting people where they are, because people are at their homes, they're on their phones, they're texting, they're Googling things and all that stuff, but they still need care, and they still need to talk to like a, OBGYN or a doula or a midwife or someone on their phone. And that's kind of where we come in. A lot of our focus, of course, has been on that university target market, like I said. There are a lot of, there's a lot of conversations around, okay, are students actually going to go back to school? Like, what's going to happen? And these students are paying a lot of money in like tuition. Of course, like when I think about it, and this is very personal to me because I was an international student. So imagine like people like that cannot go home because they can't travel home, but now they're stuck in school and they don't now have all the resources that they used to have. So for us, our whole goal is kind of, like I said, step in there now exactly when they need it and provide all these resources, because at the end of the day, life is going on, classes are going on virtually, and your healthcare shouldn't stop either. So, yeah.
Yeah, the restrictions coming down has been really good for people that have businesses around telemedicine right now, which I've thought is really interesting. I know there's some challenges, but I think that you're right. Things don't stop. Just because everyone's locked in their house right now doesn't mean that their needs don't stop. You still have to
Right.
be able to get the care you need in the time that
Hmm.
you need it. You can't just put stuff on hold.
Absolutely.
Yeah.
Absolutely.
And it's just crazy. And speaking of the program being virtual, how has the program being virtual impacted you and your experience so far?
Okay, so it has impacted me in the aspect of I was struggling at first. I was like, can I attend every single session? Because I actually live in Los Angeles and the program was in Philly. And I did make arrangements for that. So between myself and my co-founder, Dr. Candace Fraser, who lives in New York and is just a bus driver, car ride away from Philly, attending, side by side and working together to do that. And what has happened now is, because we've moved to virtual, I'm not able to travel. That's one. And not being able to travel means I can sit down like this and like participate in every single session. I'm even now enjoying virtual more than anything, honestly, because that's just how, this life is, like our current state of affairs and our new normal, so to speak. So that has been that impact in terms of keeping me, in the weeds. Like prior to the pandemic happening, I was having conversations with the team, the launching team around, okay, like how do I join if I'm not there? And I know one time whenever my co-founder came in place of myself, I actually joined virtually that day as well. And it was great and I enjoyed it. And then the pandemic hit and everyone had to, do the virtual sessions. So I'm happy about the sessions. I do wish, we still I do wish we're able to still do this, kind of in person. I feel like there is a huge value of in person connections. The couple of times that I did come to, in person, I had an amazing time. So, I say that to say, of course, 1 second. I say that to say, of course, I, would love it to come back live, but for the time being, it's working out.
Yeah, in many ways, the program has become beneficial for those who cannot travel here
Mhm.
very easily. And I think that
Absolutely.
it makes me want to rethink what it means to create a program that's accessible.
Right.
Because right now, I mean, there's even just the cost of going back and forth. It's difficult, and I've worked with other accelerators as well. And when you're, you know, everybody wants for people to be able to have that in person interaction, but right now with everything going virtual, we've been able to prove so many people wrong on a lot of these things. Right? Everybody thinks like, oh, you got to go to school in person.
Yeah.
Everybody's thinking switch to virtual. No, it's possible to take a class online. It just might not be the same experience. And
Right.
I mean, the human experience of like interacting with someone face to face is still very much preferable. But I do think
For
that
sure.
it's important to make, it's important for us to find new creative ways to make
Mhm.
programming accessible to people who are not here in Philly, but want to participate.
Absolutely.
And my hope is always that we can convince people to move here. So if you come here enough times and enjoy it, maybe you'll consider that. But
Yes,
it's up to you to decide that.
absolutely.
Philly is a great city. Um,
Absolutely.
has have has your company been able to take advantage of any of the COVID-19 related grants or loans? Have you been able to apply to any
So
or?
yeah, so we've applied to some grants, still waiting to hear back from some of them. As far as the loans go, the whole eligibility of the loans and having like so for our company, for example, we have majority independent contractors. In that versus like the W-2s who are full-time who if that was the case and if like we filed our taxes like a year ago and this happened, yes, we would have been eligible, but being in this situation makes it very challenging for a new company, especially a new company that doesn't have that staff yet, that just hired a bunch of staff and like navigating that. So, if I wish it was a situation where based on your staff, so like in our company having over 20 something people like in the company, majority of which are independent contractors. So how do you get loans for those types of people versus, the loans only benefiting folks who've been in business for like 5, 6 years now? What about all the folks who probably started now who have profitable businesses but are not eligible for the things that folks who started like 2 years ago, for example, are eligible for, right? So that's just a thought around that. But fingers crossed, we're being very positive, of course, and hopeful that we do get one of these grants. There are so many out there, a lot of them focused on like women and minority founders and small businesses. So we are taking advantage of them by applying to a bunch of them because that's kind of really all you can do because everything is so uncertain right now. So taking advantage of the stuff that is available.
Yeah, I'm glad you said that because in a lot of the conversations I've been having, people have either tried and given up because they're like one element just is out of place and it's not going to work for them for the federal opportunities. But you're right, there are a ton of different programs that are opening up every day. There's something, and yeah, it takes time to apply to these things, but if you do have a lot of contractors, which I've had experience with that before, um, it's the only thing that someone can do in that situation is help people apply for the pandemic unemployment um, compensation. But if that's the case, then they can't work, right? So it's like you're stuck in this weird
Right.
loop where it's like you want to help the people who fill in those hours for you, but as soon as someone applies to the unemployment, they're losing out one way or another. They're losing out on work,
Right.
or they're not going to, or they're
Or
taking work still and they're not getting paid enough because they're doing a little bit of both. Is like it's such a crappy cycle to
right.
be in. I'm glad that the pandemic insurance or pandemic unemployment compensation, I don't know, PUA, pandemic unemployment assistance. That's what they're calling it, PUA.
Mhm,
I'm glad that the
mhm.
PUA website has opened up for contractors. So I mean, right now
Okay.
the great thing is contractors can apply for uninsurance. For Pennsylvania, I don't know for California, but I know for Pennsylvania, it took a while, weeks for them to get a new website up for unemployment for contractors only. But I think people should know it is totally possible for contractors to apply for it, but then they still have
Mhm.
to it doesn't help the business. It only helps that person, and then you still
Only helps
lose
them.
that. Then they can't work for you because they're not getting
Mhm.
paid from you. It's just a cycle. It's just not fun in
Right.
that kind of way.
Absolutely.
So I hope
Absolutely.
that yeah, I hope that more people that are in the decision making seats come up with some creative ways to support companies that are earlier stage and haven't done taxes in the past couple years yet because
Mhm.
they're new. Because we need you to be able to continue to thrive, and I would say
For
you have
sure.
been thriving because I mean, Kliit Health. I've seen you pop up on some of my feeds. I feel like you're doing a lot of things. I feel like you've been staying pretty busy.
Yeah, I mean, at the end of the day, like, it is a new normal, but at the same time, you got to keep working, got to keep connecting. You have to create an ecosystem, right, at the same time, because that's the whole goal, to keep people connected in this time and take advantage of the fact that we're at home. Like, we're at home, we're not doing anything. It's time for community. It's time for building that, and it's time for bringing up innovative ideas in this time. There's so much stuff that has popped up that people are building or doing or what have you, due to like the current state of the pandemic. So we do our own part to stay busy. And what's pretty cool about running a startup is the ability of just adapting to change, and kind of like, it's not direct like pivots per se, but like pivoting as needed, based on growing the company, right? And just being okay, like, this is how the world is today. We're on it too. Like, just keep working instead of waiting for when things adjust back to normal, because we don't know what's going to happen in the next couple months. It is all very uncertain, but we're busy. Or we try to be productively busy and make sure we're doing things that actually scale, versus just doing everything. So we are taking some time, like, okay, what are the top priorities that will move our company to the next level? Is it more people knowing about us? Is it being in front of more like customers or future partners or whatever it is? That's what we're going to do. So that's kind of where we're at.
Yeah, I think that's a good thing. That's a good thing. You got to stay out there. And what,
Yeah.
if anything, would you say you've learned from this experience?
You mean launch lane or
The
pandemic? Because
I guess the let's go with the pandemic, and if you want to throw a launch lane in, go for it.
so yeah, what I have learned is that people don't know how to be by themselves. um, a lot of people ask me, they're like, "Oh my God, how are you doing?" Blah, blah, blah. I'm like, first off, I'm an entrepreneur of a startup, like a startup. So I do spend a lot of time by myself. Like, I kind of, I mean, you like the interaction and the collaboration from folks that you work with in an office space, but you are in charge of 1000% of your time and your schedule and your day. So a lot of people are, find it challenging to manage their day outside of an office. But that is something as entrepreneurs we know how to do. It's like, we know how to manage our days. So I feel like we're in this teaching state where we're like, we'll let you 9 to 5ers know how to accommodate life and still stay sane. I mean, like the thing that I've learned even in this time is, yes, of course, there's a lot of collaboration going on. There's a lot of folks who are coming out who are really interested in helping founders grow. And in this time, there's so many resources, like I said, like that's just what I've learned from the pandemic. Like, wow, like there's so many people that are actually doing stuff for founders. I didn't know this, like up until now, like, oh wow, like, I've applied to some things that I was just like, if the pandemic didn't happen, we would have probably not seen this. So that has been good. But it's kind of adjusting and just being able to mental health being one thing because it is hard. Not everyone is dealing with this well. Some people are dealing with serious heartbreak right now, being like losing jobs and being unemployed for the first time in a very long time. Like you still have bills, like some people are not eligible for like certain types of federal things. So it's like, okay, like my tax bracket was high and I'm not eligible for this, but now I lost my job. Like, what do I do? So, there is, like I said, an element of heartbreaks that are happening and people actually struggling in this time. I mean, a lot of people are, facing losing a loved one and whatever it is. So it has been a challenging time, but at the same time, I have seen a lot of people come together to like lift each other up. And I think that's what's super cool. And that ties into like Launch Lane, like really having a community where you can go to and be like, this is the reality of today. It's not fun. I'm not going to come here and pretend like I'm a superstar CEO. I struggle every day and I have things happen. And I want to, I'm learning from people who are also struggling in the same way. And we're kind of building each other up in ways that maybe we couldn't have been able to do if we weren't, because now, you can really actually focus because there's not so many distractions left and right. People actually tend to be more productive when they work from home. I remember, when I used to work in corporate and I had like my job, like you would talk to like coworkers, people are running down the hall, like fire drill. There's something happening all the time. But when I did take work home, I noticed that I was so much more productive, like being at home. And also, folks at my job at that time that I'm actually working, I'm going to do more at home versus
I'm
anything else.
so
So,
I'm so curious to know what your personality type is because the
yeah.
it's funny because some of the things you say, I'm like I'm like borderline. I agree with I agree, and then I'm just like, oh, but because I think earlier I was telling somebody how my trouble with working from home is I don't want to be in my house, and I don't. It's not to say that I don't want to be alone as a
Mm-hmm.
whole, but there's something about being able to see like movement of people, and I am a
Right.
talker. So like I will say like for me, a lot of my work is involves like the relationships that I build with people in the community. So like if I'm not there, it makes it more challenging. And one example I gave was when you go to a virtual conference, you can no longer meet someone in that space and step aside and have a conversation. And a lot of like whenever I meet new people, a lot of that happens at conferences or these different networking events. And then on the other hand, there's definitely when I was in college, I used to be the person that locked myself in the study rooms and like worked alone for hours. And I graduated with honors. And I feel like I definitely agree with like the productivity level that I have when I'm working on something like administrative type task and or like coding or design. I'm like here at my desk totally makes sense. But like the shift that I made in my work, like the way that I run my business is it's so heavily leaning on my ability to be able to run into people, and
Right.
that like being able to run into people now like is it's just so difficult because you have to be intentional. And I think I do
Right.
think that that's also a good thing because you also touched on
Mm-hmm.
that like now people have I think it's like people have the space to think about what they are going to be intentional about. and
Mhm.
also to have some more empathy for other people, because we're all
Right.
going through something at this point in time. I mean,
Of
it hasn't
course.
been all bad for everybody, but like there are
Mhm.
definitely a lot of people that have been like slammed with a lot of negative stuff during this. I don't
Mhm.
know when I'm going to be able to go home. My mom has lupus. Um, and that's come up in a lot of my conversations. You know, just not knowing what's going to happen is frustrating, but I do think that there's definitely a lot of lessons, like positive lessons, to be learned from working in a virtual world. So
Absolutely. No, for
hopefully we'll
sure.
come come out of this with like,
Oh, yeah.
hypersensitivity to other people's issues, but I don't really know. The world is a
No,
crazy place.
absolutely. Absolutely. I am, it is interesting. Like, I am an extrovert. I'm an extroverted introvert, if that makes sense. Because, like,
Nope, me
I
too.
am very, so I do a lot of talking. I try to listen as much as I can. But I tend to like talk and people around. So I like to cook food and invite a bunch of friends, and like I like that stuff, right? And even the nature of my job, so being a CEO of a startup, a lot of what I was doing before was traveling all over, going to conferences, being in front of people. I enjoyed that stuff because I had it's kind of like you kind of have to do that to be in front of people, right? At the same time, because I have that kind of job and that is like what I do, I also fully appreciate being at home because you spend a lot of energy outside doing all these things and being cheerful all the time and doing this and doing that, and it is your personality because you're like a uppity person, but at the end of the day you still need some time to just reflect. And what has happened for me, and this is why I fully enjoy being at home now, is because from January I had done about 20 something trips outside of LA. And by the time it was February, the pandemic happened. And then I was like, pause, no more airplanes. Wow, it felt really good. So I say that to say, like, that is just why I have this perspective, because at the end of the day, like, the world is going to open back up, right? We know this for a fact. And we don't know when, but I'm positive that it will open back up and all the crazy will start again. And once it starts again, it's hard to switch it off, right? So being able to just enjoy this time is what's like very important to me. So I'm like, let me enjoy it. For example, like I had a wedding in June. It got canceled due to COVID. That's okay because planning a wedding was hard. But am I happy that there's a slowdown? Of course I am. Am I upset that I don't get to dance with my family and friends and have this big wedding? I'm Nigerian, so my wedding was going to be large. So, so is that something I look forward to happening when the pandemic goes away? Absolutely. Do I want to slow down? Absolutely. So it's a mixture of both.
I You are the second person I have interviewed who had a
Yeah.
wedding that had to be
Mm-hmm.
switched up. Yeah, it is a lot, but I do think that it'll,
Yeah.
hopefully it'll all get better. I think that you, you know we do have to learn how to just like relax a little bit, because burnout is
Right.
a real thing, and I think
Yes.
that it's very easy when you're running a company to get
Mm-hmm.
burnt out and like forget to
Mm-hmm.
take care of yourself. So I think you're right.
Yes.
Like kick back as much as you can and just focus as much as you can while you have the time and space to do it. Because otherwise, you know, if you look at this as an opportunity for time and space, you might not have this type of time and space again once things kick back in. And I know what you mean about the back and forth travel, because when I was doing all of like my public speaking really heavily, I had one week where I went. I think I went from here to Germany. I went from here to
Yes.
Germany to open a JavaScript conference, and then I flew from there to Canada, and then down to Portland to do a conference there, and then back to Philly, and then back to upstate to New York to see my family. And it was all in less than a week's period. I think I went to
Yep.
Germany for like 2.5 days.
Nice.
And then I was in Portland for like 2.5 days, and then it was the whole thing was crazy, and it is very tiring. It's exciting to get to the point where where you get to travel and
Absolutely.
meet new people, but it is very tiring, and that's one of the reasons why I've started doing morning meditations a lot more frequently over the past year. And actually, for the podcast that I do, Parallax Podcast, I just interviewed Kara Smalls, who's the executive director of Philly Startup Leaders, which is
Mhm.
the largest community of startup leaders here, and
Okay.
she's doing a morning meditation
Nice.
on Instagram. Actually, she does it live on Instagram every morning at 8 a.m. She started during COVID, and the reason is because
Mhm.
she's also an entrepreneur. She's working with entrepreneurs, and it's it's a really good time for people to kind of hone in on what they want their self care regimen to be if they don't already
Mhm.
have one. Because right now,
Right.
like, what are you going to do if you're not taking care of yourself? It's a
Mhm.
crazy time.
Absolutely. So yeah, it is an absolutely crazy time. So just taking time to pause. I know, like we had a health, like a Fem Health Tech conference, like this past weekend, and one of the main things that we did in part of the sessions was a meditation session where people got to actually like breathe and pause. And by the time I was done with that session, I was like, "Are we still doing this conference? Because I'm good." And it was just releasing everything and just being like, okay, it's good to take a moment and breathe and really like get in tune with yourself again, because there's a lot happening and a lot to take in for just one person, right? The occasional and breath work and stuff, and just appreciating life and just taking things easy. Self-care, most importantly. Like I never truly had like a self-care regimen per se when it came to like my mental health or even like my physical. Like I go to the gym, I lift weights uh, once in a while. However, I just I would say like 2 weeks before the pandemic, I got a Peloton and I've been riding every other day. Like this is the best shape I've been in my life. And I know that's not the case for some people because, the pandemic has been hard on them. But, for me, it's just like, I want to take time. Like if you're traveling, you don't get to do that. You don't get to do any of these things. And you might lose weight, but it's not the good kind of weight loss, it's stress. Right. And you might gain weight due to stress. And it's just all those things part of it in terms of how do I stay sane? How do I keep my body in shape and still run a company, do business, and be productive in general? So I don't know. I feel like there's been good things and there've been bad things. So just trying to appreciate the ones that are good is just my motto.
Yeah, I think that's so important. And what when all this is over and it's safe for us to reemerge from our homes, what are you looking
Right.
forward to?
Ooh, I am looking forward to first doing my wedding again, doing my wedding next year, maybe. I'm looking forward to that. Absolutely. Like you've spent all your life. I mean, some people, this is me. Like I've wanted to have this wedding, and then you plan it for a full year, and then this happens. So I can't wait to do it properly. That's one. I also miss like being in front of folks. Like, all we're gonna do was, going to universities and colleges and speaking to young people, like their sexual health and reproductive health, and just like their behavioral, holistic health care. And one of the bigger events that I was supposed to do got canceled the day before because of COVID. And that was a bummer because, my whole goal is to inspire young people and just share my story because, you can share your story virtual, but it is very different when you do it in person. And that's something I feel like that's another thing that I haven't quite loved about this. So I used to do a lot of pitch competitions and be in front of people, and then moving it virtual just makes things much harder. It just makes things rather awkward. Sometimes, and then there's glitches, and then there's technical difficulties and all these things. So just going back to just how life used to be, I guess, and being, I guess one thing that I really truly miss is hugging people. I'm a huge hugger, and I haven't hugged anyone that's not my fiance for a very long time. So that's what I miss.
I totally get that, and I, it, you're you're maybe the third person that has said that this week to me about just wanting to be able to hug another person again. And I can't tell you how many, to be honest, I can't tell you how many people I hug just working out of IC 3401 and being downstairs in Quorum. When I'm
Yeah.
when I'm in quorum, I run into so many people, and I don't think I've ever really left there without having like a hug happen somewhere. Like there's
Yeah.
I get a hug at least once a week when I'm there. So I appreciate that. It's going to be a little awkward to go back into these spaces with mask on, but I'll just be happy to be around people again, and
Absolutely.
make the space for that. Um,
Absolutely.
and the other thing I want to know is, what would you say is your superpower?
Ooh, my superpower. I like to make people feel good. I don't know. Like I I think it's just making people feel good about themselves. I am like we talked about earlier, like I don't have a sister. I'm an only girl. I have five older brothers actually. So, I
Oh
am very
wow,
like, yeah. So I am
a lot
very
of
mother
boys.
nature. Yeah. So because it's just me and my mom, and it was always like a very mother vibe that I have growing up. So I just like to like embrace people. Like I'm the young old mom person. I think that's what it is, and I tend to just make people feel good about themselves. I think that's hard.
I appreciate that. That's wow. That's a lot of brothers. That's just a lot. That is, whew, I couldn't imagine. I'm a middle child, and I have a younger sister and an older brother, and
Mm-hmm.
I I feel like being in the middle of that, I've been able to get away with a lot of stuff without my family noticing. So I appreciate you for
That's
that.
awesome.
Um, yeah, I don't think I would. I think it's like for me, I'm like I like the balance of one brother, one sister. I could not imagine five of my brother. And I mean, mind you, it's not like all guys are the same, but like, just sounds like a lot of
They're,
different
yeah,
energy to deal with. I'm sure
yeah,
they're wonderful,
yeah.
as all siblings are. We're all
Mm-hmm.
wonderful in our own kind of way. How can
Awesome.
for anyone that's listening to this, how can we help you advance what you're doing with Kliit Health? Are you looking for additional funding? Are you looking for partners? Uh, Tell us how they can get in touch with you.
Absolutely. So yeah, so thank you so much. So we are of course fundraising right now. It is a pandemic. It has been challenging in its own way. But so yeah, so we are looking for folks who are of course aligned with our mission and want to support us in the area of funds. Also looking for university partners to roll out our university product too. So if there's any, student health services director or something like that out there that we could get connected with to do a demo of our new product, Kira. We'll love to discuss with them. And also, we always, my whole thing is go download our app. We have clinicians that are there ready to talk to you. So we always encourage people to go download. So yeah.
Awesome. And your website, you want to share that?
Okay, so yeah, so our website is kliit.com, so kliit.com. And, like for the university administrators who want to reach out to us, it's kiira.io, so they can go there and schedule a demo.
Awesome. Thanks so much for joining me on this call
Awesome.
today, Crystal. Uh,
This is
all the
great.
way from all the way from California. Uh,
Mm-hmm.
in the pandemic, we're just living our
Yes.
lives virtually here we are,
Day by
and
day.
day by day. Can't wait to see you in person again. And I wish you well going through the rest of this.
Absolutely. Thank you so much. This was great.